Good morning, everyone. In this presentation, we will be exploring how the process of aging affects the human endocrine system. We will start by a brief introduction to the endocrine system, after which we will explore how aging affects this system. We have categorized these effects into three categories as shown on the screen. For each category, we will be expounding on both the effects of aging as well as good ways to adapt. The endocrine system is an organ system that consists of several special organs and glands that produce and release hormones within the body. These hormones are chemical signals that are released by glands directly into the bloodstream. Hormones work to regulate various functions of the body by carrying out different effects at target cells located throughout the body. Some of the hormones we will be covering are adrenaline, thyroxine, testosterone, and estrogen. Let's start by exploring how aging generally affects the endocrine system in males and females. Later on, we will be diving deeper into the effects of aging on persons of different genders. There are two common effects of aging on the endocrine system that we will be elaborating on today: decrease in thyroid hormone and increase in parathyroid hormone. First, let's explore how the decrease in thyroid hormones affects our body. As we age, the thyroid gland produces less thyroid hormones. This leads to a decrease in the amount of energy consumed at rest, which is known as the basal metabolic rate. This leads to a reduced production of body heat and gradual increase in body fat percentage. The insufficient production of thyroid hormones by the thyroid gland can lead to hypothyroidism, which is a condition that leads to low metabolic rate, weight gain, and other effects, as seen on the screen. The risk of developing hypothyroidism increases with age due to many factors. In women, the increase of anti-thyroid antibodies is a leading cause of hypothyroidism. Another reason is that elderly persons are more likely to have comorbid diseases, which increases the risk of hypothyroidism and the severity of its symptoms. Unfortunately, it is impossible to completely prevent hypothyroidism in persons who are genetically predisposed to developing this condition. There is one exception though. When the root cause of hypothyroidism is iodine deficiency, increasing iodine intake through your diet could help to reduce the risk of hypothyroidism. This can be done through consuming more milk and dairy products, saltwater fish, or even taking iodine supplements. Now, let's explore how aging affects the production of parathyroid hormone. As we age, the parathyroid glands produce more parathyroid hormones. This stimulates the demineralization of bones to increase blood calcium concentration. Chronically high levels of PTH leads to a condition known as osteoporosis. Osteoporosis is a condition that causes a decrease in bone strength, leading to an increased chance of bone fractures. As we age, the rate of bone resorption surpasses the rate of bone formation. This leads to the spaces between trabeculae to become larger and spongy bone, and layers of compact bone to become thinner. The decrease in density of bones leads to bone mass deficiency, and the resilience and strength of bones decrease. This is known as osteoporosis. To decrease the risk of developing osteoporosis, we should aim to inhibit bone resorption and promote bone formation. This can be done through many ways as seen on screen. For example, adapting our diet to increase consumption of calcium, vitamin D, and protein.
When females reach around their mid-40s, they will start going through menopause, starting with perimenopause. Perimenopause takes place right before menopause, when the body transitions towards stopping periods. The hormone levels of both estrogen and progesterone would fluctuate during perimenopause, causing the amount of estrogen produced to get inconsistent during perimenopause. In the early stages of perimenopause, estrogen will often spike higher than in reproduction years. And during late perimenopause, estrogen levels declines overall but vary cycle to cycle. Follicle-stimulating hormone would rise during perimenopause, causing the ovary's response to become less effective and hence leading to the failure in development of mature follicles in many cycles. This results in ovulation becoming irregular, and when there is no ovulation, no ovum will be released. The progesterone level would become unbalanced due to the decrease in estrogen levels. On a normal period after ovulation, progesterone levels will increase to counter estrogen and cause the build-up of the uterine lining. Progesterone would not be produced when ovulation doesn't occur. How do you know when your perimenopause started since it varies for many people? The symptoms are usually irregular periods where it could get longer or shorter. The cause of irregularity is due to the ovulations being skipped as the ovaries do not have many ovum. Fertility would decline as the number of ovarian follicles will have dropped during aging and hence ovulation is harder to trigger as there are lesser healthy follicles available. The urethra tissue, bladder, and pelvic floor muscles contains estrogen receptors. The drop in estrogen levels causes the tissues to become thinner, dry out, and become less flexible. When the pelvic floor muscles are weakened, the control and support of urine is lost. Perimenopause tends to start around one's mid-40s and last for 8 to 10 years. However, some factors could cause an early perimenopause. Family history of an early perimenopause could be passed down. If one has been through cancer treatments like chemotherapy, it could cause early menopause as these procedures damage or destroy ovarian follicles. Smoking could lead to faster ovarian aging and follicle depletion, causing them to go through menopause 1 to 2 years earlier. After hysterectomy, which is the removal of uterus, menopause may occur earlier due to a shortened perimenopause, though estrogen from the ovaries means perimenopause still happens. When one has gone through 12 consecutive months without a menstrual period, it signifies the start of menopause. It typically occurs around the age of 52. During menopause, the ovaries will stop producing reproduction hormones like estrogen and progesterone and stop the release of ovum. This process is permanent for life and cannot be reversed. Unlike menopause symptoms bring long-term change like weight gain. The decrease in estrogen causes the body to store more fat and at the same time decrease the rate of calories being burned. This is due to estrogen always playing a crucial role in regulating metabolism and fat distribution in the body. At the same time, estrogen also helps maintain hair density, fullness, and growth. When it decreases, one will experience hair thinning. At the same time, the progesterone level drops as well, contributing to skin dryness. One might experience hot flashes and night sweats as the hypothalamus, which regulates the body temperature, becomes more sensitive when estrogen levels drops, causing the brain to misinterpret the slight change in body temperature to be overheating. One will also experience bone loss leading to a higher risk of osteoporosis. To counter the menopause symptoms, one could try to increase the intake of calcium and vitamin D for better bone health. Reducing the intake of processed food and sugar can help lower inflammation and support hormonal balance. Exercising at least 20 minutes a day will help reduce stress and improve sleep. At the same time, strength training helps combat muscle loss and maintain energy balance. Meditation could help calm your mind and body and cope with stress. Magnesium supplements could also promote relaxation if one requires it for easier sleep.
Postmenopause is the stage of life that follows after the phase of menopause, and one would be in this stage for the rest of their lives. Symptoms from menopause can be continued during postmenopause until the end of life. Depression occurs as a symptom as hormone levels are decreasing during postmenopause, increasing the risk for depression. However, there might be other factors contributing to depression, like stress or lifestyle. One will also experience hot flashes as estrogen production becomes very low during postmenopause. Moreover, urinary incontinence is a symptom which might persist from menopause due to the constant low hormone levels. During postmenopause, the risk of experiencing a cardiovascular disease increases as estrogen helps to protect against them. However, estrogen levels would remain low from menopause onwards. If one to will actually experience depression, they should seek therapy and see a doctor. To deal with hot flashes, one could hydrate with cool drinks or meditate like mentioned earlier. A way to decrease urinary incontinence and strengthen the bladder is to do pelvic exercises. To prevent cardiovascular diseases, one should try to lead a healthy lifestyle by eating nutritious and healthy food, doing regular exercise, and avoid smoking.
So when it comes to the effects of aging in the male endocrine system, our main focus will be on andropause, which is also known as late-onset hypogonadism. It is a condition whereby patients experience a gradual but progressive decline in testosterone levels that is age-related. Looking over the key aspects, late-onset hypogonadism does not actually start at any specific set points and actually varies in terms of severity across patients. Furthermore, it can be split into three categories: primary, secondary, and mixed. In primary hypogonadism, low testosterone and infertility are caused as a result of disorder of the testes. In contrast, in secondary hypogonadism, low levels of luteinizing hormone and follicle-stimulating hormone are observed in the patients as a result of disorders of the hypothalamus and pituitary gland. Luteinizing hormone is responsible for sperm production as it stimulates the testes to produce testosterone, while follicle-stimulating hormone is responsible for stimulating and sustaining sperm production along with testosterone. Lastly, mixed hypogonadism is usually a result of dual disorders in the testes and pituitary hypothalamic axis. In older men, secondary or mixed hypogonadism are more frequently observed. So some causes are a decline in Leydig cell function, which are the cells responsible for secretion of testosterone, a decline in pituitary hypothalamic axis function with loss of circadian variation, increased levels of sex hormone binding globulin, which are responsible for regulation of sex hormone levels, changes in sensitivity of testosterone receptors, and effects of altered cardiometric and inflammatory markers. In addition, risk factors such as HIV and AIDS, undergoing chemotherapy or other forms of radiation therapy, obesity, poor diet, and obstructive sleep apnea can actually increase risk of late onset hypogonadism. Finally, when we look at the effects, most patients suffer from erectile dysfunction, infertility, reduction in growth of facial and body hair, reduction in muscle mass, gynecomastia, which is the growth of breast tissue, and osteoporosis.
There are a few ways to curb the effects of hypogonadism. Some examples include testosterone replacement therapy, which is a way to replenish testosterone externally. Next up, we have lippers, which is a non-invasive method to enhance testosterone secretion. VDAC1 peptide works by increasing a cholesterol transport to mitochondria due to a binding occurring that reduces interaction with VDAC1. Lastly, stem cell transplantation, which restore Leydig cell function, thus increasing testosterone synthesis. Amongst all interactions, we feel that testosterone replacement therapy is the easiest to carry out. The rest of the options are either not done with clinical research or too troublesome to start treatment. What is testosterone replacement therapy, you may ask? It is for men looking for testosterone medically to curb with low testosterone. There are different dosage forms available to regulate the hormones. This typically works by offering external testosterone into the body to help curb effects of hypogonadism, which would cause to stop producing testosterone. However, it can improve sexual function, bone mineral density, as well as energy levels. There are effects to testosterone replacement therapy, which includes acne or oily skin, mild fluid retention causing swelling of ankles, and many more. Thank you, everyone.